Hello everybody, I am Dr. Anil Kamath. I am a consultant surgical oncologist here at Healius Cancer Clinic. So today let me take this opportunity to talk to you all about endometrial cancers. Now what is endometrium? How frequently does cancer happen here? How is it treated? I would mainly like to touch upon these topics. Endometrial cancer is one of the more common cancers in females. When we tell endometrium, it is the innermost lining of the uterus. The endometrium is the place where the fertilized egg goes and implants. Cancers in the endometrium are fairly common. How does it present? Now, the most common way in which endometrial cancers present is as postmenopausal bleeding. So, when a lady has completed her menopause, say in India, this is normally around the age of 50 or so. After the menopause, if they have bleeding or spotting, that is where endometrial cancer has to be suspected. Who are the people at risk for endometrial cancer? Those who are obese, those who have a family history of breast and other cancers, these are the patients who are at more risk for endometrial cancer. This does not mean that it does not happen in other people. Older women are more susceptible for endometrial cancer as compared to younger females. How is it diagnosed? So, whenever a lady has postmenopausal bleeding, she has to take it seriously and visit her doctor. Not all cases of postmenopausal bleeding are due to endometrial cancer, but that is something which has to be ruled out. So, usually, when these symptoms are there, the first investigation which is done is usually an ultrasound abdomen, and this may include a transvaginal ultrasound also. Here, we expect that the radiologist will tell us what the endometrial thickness is. Normally, after menopause, the endometrium is supposed to shrink and it will not just be a few millimeter, just 1 or 2 millimeters. But when there is increased endometrial thickness, this is where endometrial cancer is suspected, especially if the sonologist says that it is irregular. So, that is the first step towards the diagnosis of endometrial cancer. Again, the increased endometrial thickness need not always be due to cancer, it may be due to just hyperplasia of the endometrium. But once the suspicion is there that this could be endometrial cancer, then we need much higher investigations. Usually, we do a MRI scan of the pelvis to see whether it is really irregular, how deep it is going into the uterus, and whether it has spread to the nearby lymph nodes. Along with that, a biopsy is also required. The biopsy is taken in different ways. As an outpatient procedure, a pipil biopsy or endometrial biopsy can be done, and in certain other cases, a DNC may be required. Basically, when I tell DNC, it will be a short anesthesia procedure where the innermost lining is scraped and sent to the pathologist to check if there is cancer or not. So, once there is suspicion of cancer, the next this one we have to see how much it has spread. As I mentioned earlier, we might have to do an MRI to see how much it has spread, whether it is just confined to the uterus or whether it has spread to the nearby lymph nodes or to any far off areas. Depending on the stage of the disease, the treatment is offered. Treatment is preferably done by an oncologist who is experienced in dealing with these cancers. So, surgery is the mainstay treatment. Most endometrial cancers, luckily for us, are detected in early stage, and surgery is the most important part of the treatment. In the surgery, the uterus is removed along with both the ovaries in most of the cases. Along with, as required, we may have to remove the surrounding lymph nodes. So, we call this procedure as panhysterectomy with pelvic node dissection. So, this operation can be done by laparoscopic method or robotic method and the traditional open method. So once the surgery is done, whatever is removed will go to the pathologist, and in a higher stage, suppose the pathologist says that the cancer is of a more aggressive type or it has spread to nearby areas, then there may be requirement for additional treatments like chemotherapy or radiation. In terms of outcomes, endometrial cancers, most of them have got a good prognosis, and if it is properly treated, it can be cured in majority of the cases. Thank you.